Hello everyone, welcome to another video session on forensic medicine. Today we are going to discuss a very short topic but a very important topic, that is infant death and associated conditions including medico-legal importance. So you have to remember certain terminologies here. Number one is infanticide, means unlawful destruction of a child under the age of 1 year. Infant means 1 year child. Feticide means killing of fetus at any time prior to birth. Filicide means killing of a child by its parents. Neonaticide means deliberate killing of a child within 4 weeks of its birth. Fine. What do you mean by the term stillbirth? Very, very important. In India, stillbirth is defined as a child born after 28 weeks of pregnancy. Remember, that is called the period of viability, which did not breathe or show any other signs of life at any time after being completely born. Fine. So, what are the common causes of stillbirth? The most common cause, just to remember a single one-liner question, the answer is prematurity. Prematurity is the single most common cause of stillbirth. What do you mean by dead birth? That means a child which has died in utero and has been expelled out of the uterus. That is called dead birth. That is, or a dead born child. What are the signs of dead birth? At delivery, there will be rigor mortis. There will be maceration. What do you mean by maceration? Maceration is nothing else but it is a process of aseptic autolysis. We have something called septic autolysis and aseptic autolysis. It is actually one of the changes. Okay, decomposition changes are following death. It is actually a late changes of death. Here there is aseptic autolysis. We call it as maceration, which occurs exclusively with the in utero in case of intrauterine dead babies. Remember, what is the earliest sign of maceration? It is the reddening of skin with peeling and slippage, which can be seen in 12 hours after death of the child. And here a very, very important MCQ question, gas will be present, especially in aorta and large vessels, which indicates fetal death. That is called as Robert's sign. And the body of the macerated fetus will be soft, flaccid. There will be a sweetish and disagreeable odor. Okay, and large blebs will be formed within 24 hours, which contain red serous or serosanguinous fluid. And very, very important thing, there will be collapse of the brain and collapse of the vertebral column, and we have something called as Spalding sign. What do you mean by Spalding sign? Again, it is another important question. Spalding sign is nothing else but there is loss of alignment and overriding of the bones of the cranial wall, because after the death of the fetus there will be shrinkage of the cerebrum. Following that, there will be overlapping of the cranial wall to bones. Okay, and finally we have something called as mummification. That means the fetus dies from deficient supply of the blood, and liquor amini will be scanty, and the air does not enter the uterus. Very, very important. When air does not enter the uterus, then only mummification of the fetus takes place. So remember, viability is nothing else but the physical ability of the fetus to lead a separate existence after birth apart from its mother. Okay, fine. So coming into live birth, what are the signs of live birth? See, that means a child shows signs of life only when only part of the child was out of the mother. Am I right? Though the child may not have breathed or completely born. So that is actually called as live birth. And here we have certain important signs of live birth. And number one is hearing a cry, seeing movement of the body or limbs, muscle contractions, etc. Okay, fine. So here, remember, once a child is born, the respiration starts off. Am I right? The respiration is kicked off. So there is some changes in lungs. So this will help us to differentiate whether the baby is born alive or whether this baby is dead within and it is expelled out of the uterus. That is, there are certain set of changes which can be observed exclusively in the lungs. For example, if before respiration, the lungs will be 1/70 of the body weight. After respiration, because of air, the weight will increase. So it will become 1/35. The volume will be larger, soft, spongy, rounded, mottled or marbled appearance, inflated, abundant frothy blood, expanded areas, or it will float in water. Before respiration, the lungs will parts sinks in water. Okay, fine. Fine. And here comes certain questions that, certain important tests that you have to remember. That is, number one is called as Static test, also called as Fodder's test. What do you mean by Fodder's test? Remember, before respiration, the weight of the lungs will be 40 gram. After respiration, it will be 60 gram. That is it. Why? There is increase in weight because of the increased flow of blood. Second test is called Plotter's test. That means because after respiration is initiated, blood flow in the lung is increased, the weight will be doubled from 1 by 70 to 1 by 35. Before respiration, it is 1 by 70 of the body weight, and after respiration, it is 1 by 35 of the body weight. And we have a very important test, that is called the hydrostatic test, also called as the Raygaard's test. Raygaard's test, also called as the hydrostatic test. That means, again, here remember, the volume of the lungs will be increased once the breathing is initiated. Am I right? Yes. As a result, there will be some changes in the specific gravity of the lungs also. For example, I told you, before respiration, the lungs will sink in water, whereas after respiration, the lung will float in water. Okay? This is actually the point important you have to remember in case of what we call as hydrostatic test, also called as the Raygaard's test. This is a very important question, because we have some certain fallacies are there. Okay, for example, the lungs will look expanded. So what do you mean by expanded lung? That means the respiration has been started, but there are some certain conditions which will give us a false result. For example, even though the lung is expanded, it will sink in water. What are the conditions? In case of acute edema, pneumonia, congenital syphilis, okay, atelectasis, and complete absorption of air from the lungs, or air is not entering the lungs due to feeble respiration, obstruction by an alveolar duct membrane. So these are the various causes in which even an expanded lung may sink in water. Second thing, lung is unexpanded. What do you mean by unexpanded lungs? Should normally sink in water, but here the unexpanded lung is floating in water. Why? Because of the putrefactive gases. Okay, and second is because of artificial inflations, like because of any endotracheal tube or catheter or a cannula. Okay, and next is because of any external cardiac massaging. Okay. In certain conditions, hydrostatic test, also called the Raygaard's test, is not necessary when the fetus is monster, when the fetus is macerated, fetus is mummified, when the fetus is born before 180 days, when the stomach contains milk, whenever the umbilical cord has separated and a scar has formed. So these are the various conditions in which there is no need to perform the hydrostatic test, also called the Raygaard's test. Okay. What do you mean by signs of struggle to breathe? That means shortly after delivery, there will be extremely very difficult for the baby to breathe in certain conditions. For example, because of carboxyhemoglobin, okay, cyanosis, because of inhaled liquor amine, because of obstructive emphysema, liver swelling, distension of large bowel with meconium, ascites or retroperitoneal edema. In all these conditions, there will be signs of struggle to breathe will be present. Fine. What do you mean by respiration before and during breath? After the rupture of the membrane, the child may breathe. That is actually called as, in the mother's womb, that is called vaginitis uterinus. Sometimes the child may breathe while its head is in the vagina. That is called vaginitis vaginalis. Remember, proof of breathing is not proof of live birth. That means if a child is breathing, it doesn't indicate it's a live birth. Why? Because I have told you, the child may have breathed within the vagina, within the uterus, but has been brought dead. Okay, has been born dead. Okay. What are the tests for fetal lung maturity? It is the lecithin, creatinine and fasted. Out of that, remember, lecithin sphingomyelin ratio. Okay, I am writing here the lecithin sphingomyelin ratio more than or equal to 2. It's an indicator of fetal lung maturity. So that is actually called as the hydrostatic test. Okay, that finishes actually what we called as the hydrostatic test. Then comes something called as Breslau's second life test. The one which I have discussed now, that is actually called as the Breslau's first life test. And what do you mean by Breslau's second life test? It is also called as the stomach bowel test. Okay, that means the stomach and intestines are removed after tying double ligages, and they float in water if the respiration has taken place. Okay, they float in water if the respiration takes place, otherwise they sink in water. This is actually called Breslau's second life test, also called as the stomach bowel test. Fine. What do you mean by Redin's test? That means before birth, the middle ear contains some gelatinous embryonic connective tissue but no air. When the middle ear is opened under water, by removing the tectum tympani, if a bubble of air comes out, that means Redin's test is positive. Again, it is a sign of live birth. Okay. So, Live birth is probable. Live birth is probable when all lobes of lungs are fully expanded with or without obstructive emphysema. Whenever there is a gross edema of the lung because of the increased blood supply. Okay. Whenever the contusions of lungs are present. So all these cases, live birth is probable. Stillbirth is probable in case of maceration, whenever there is a flooding of lungs with lycramine, whenever there is a distension of bowel with meconium, whenever there is a desquamation of bronchial epithelium. In all these conditions, stillbirth is probable. Okay, fine. Coming to what are the changes in child after birth? In that, remember what is meconium? It is a green viscid substance consisting of thickened bile and mucus. It is completely excreted from the large intestine in the first 24 to 48 hours after birth. Very, very important. Okay, meconium aspiration is more common in post-term babies. Okay, that is the baby born after 42 weeks of pregnancy. Here comes the two important questions. Caput succedaneum and next is called cephalhematoma. Okay, both are a confusing terms. Just listen it very carefully. What do you mean by caput succedaneum? That means it is a soft swelling, okay, that forms in the scalp. Okay, it's a soft swelling. It is actually nothing else but there is a localized area of an edema and congestion. Okay, which because of some interference in the venous return, and this is most commonly following any forceps delivery. Okay, forceps delivery and all. So that is called caput succedaneum, which is forms in the scalp over the presenting part of the head in case of vertex presentation. And next is actually what we call as cephalhematoma. Okay, cephalhematoma. Remember, caput succedaneum usually disappear within 2 to 4 days after birth. What do you mean by cephalhematoma? It is actually a deep accumulation. Caput succedaneum is a diffuse, superficial collection of a fluid, whereas cephalhematoma is a deep collection of blood, which is deep to the periosteum and the bone surface. Okay, commonly the right parietal bone. Caput succedaneum will cross the suture line. Cephalhematoma, since it is a deep, localized collection of blood deep to the periosteum and the bone surface, it will never cross the suture line. This is most commonly seen over the right parietal bone surface. Okay, it increases during the first 2 days after birth, and the blood will accumulate slowly. It will undergo hemolysis. There will be increased bilirubin level, and the patient may even have features of jaundice. So neonatal jaundice is very common in case of cephalhematoma. All these things are not present in case of caput succedaneum. Caput succedaneum is a physiological one which occurs 2 to 3, and it will disappear 2 to 3 days after birth. What do you mean by vernix caseosa, which is nothing else but a fatty, okay, a viscous mucous membrane which covers the whole baby, okay, whole baby skin, okay, especially in the axilla, inguinal region and folds of the necks, and it again persists for 1 or 2 days. Okay. Next, coming into a very, very important question that is called as abandoning of infants is punishable under section 317 of IPC. Concealment of birth is punishable under section 318 of IPC. What do you mean by battered baby syndrome? Battered baby syndrome means it is also called as a child abuse syndrome. Very, very important question. It is also called as CAFE syndrome. It is also called as maltreatment syndrome in children. Battered child is the one who has received repetitive physical injuries as a result of non-accidental violence produced by a parent or a guardian. What are the classical features? Age. Remember, age will be usually less than 3 years. Sex, more common in males. Remember, he will be usually the eldest child. And as far as socio-economic factors are concerned, lower socio class and lower education. There is an obvious, the history will be inconclusive. They will be like cooking up stories. And remember, there is always a delay between the injury and medical attention. And violence is usually precipitated by actions of the child himself. For example, crying, refusal to be quiet, persistent soiling of the napkins, etc. There are some certain injuries which are classical or which suggest that the baby is like a battered baby. Number 1, soft tissue injuries are very common, especially head, face and neck, which will show bruises, abrasions and lacerations. Laceration of the mucosa is more common over the upper lip. Okay, and remember, this battered baby can present with subdural hematoma and bleeding, and that is actually called as the infantile whiplash syndrome. Subdural hematoma is because of the rupture of the bridging veins of the scalp. Bite marks will be present. Okay, slap marks which shows clear lines of petechial hemorrhages, butterfly shaped bruises, traumatic alopecia. Okay, there will be vitreous hemorrhage and subconjunctival hemorrhage. Subdural hemorrhage is more common. Then burns, like stubbing of cigarette ends upon the skin. Then skeletal injuries, more common is the skull fractures are more common. Okay, and especially the transverse and spiral fractures of long bones are also common. Then multiple rib fractures are also common, and we can see something called as a string of beads appearance in the paravertebral gutter, that is actually called as the knobbing fractures. Knobbing fractures, again it is a very important MCQ question. Knobbing fractures are seen in battered baby syndrome. And diagnosis, we have to advise a whole body X-ray. Differential diagnosis has to be made, like scurvy, congenital syphilis and osteomyelitis. Then history will be usually inconclusive. Coming to the next question, what is called Munchausen syndrome. Munchausen syndrome is nothing else but what it is malingering. Okay, that means what to say, the way that is, the person will be coming to the hospital and he will be saying that I am having so and so problem, I need treatment. He is just malingering. He don't have any problem. He want just medical attention, or he want to just escape from any punishment which is issued by the court or the police. That is called as Munchausen syndrome. What do you mean by Munchausen syndrome by proxy? That means the mother will be bringing the baby saying that the baby is having so and so problem. Okay, and again it is actually a part of a child abuse. In order to the mother would have abused the child physically or mentally, and finally the mother itself will bring the child to the physician seeking medical attention. Okay, this is called as Munchausen's syndrome by proxy. Okay, remember again it is for, there will be fictitious history and it is mainly for medical attention, and most of these mothers will be having some personality disorder. Okay, fine. So what are the 4 diagnostic criteria for Munchausen syndrome? Number 1, illness produced or alleged by a parent, repeated request for a medical care, parental denial of knowledge for the cause of symptom, and regression of the symptoms when the child is separated from the parents. So these are the 4 diagnostic criteria for Munchausen syndrome of proxy. Okay. Then coming into what do you mean by SIDS, sudden infant death syndrome, in an unexpected death of a healthy infant. Okay, that is actually called as sudden infant death syndrome, also called as cot death or crib death. Okay, I think cot death was a word which has been asked as a shortened question years back. Again, years 2 weeks to 2 years is more common. More common in males. Twins are at increased risk. Okay, and this time of death will be during the time of night, and prematurity is at higher risk. Socioeconomic factors, poor socioeconomic factors, and these parents will be having cigarette smoking and drug abuse behaviors. And remember, autopsy, we will see just some congenital heart disease like congenital heart disease, then Down syndrome and all. There will be multiple petechial hemorrhages on the basal surface of the heart and lungs. Petechial hemorrhages will be also seen in the faces or eyes, and peribronchial cell infiltration will be seen. And remember, it is always a diagnosis of exclusion. After excluding all things, finally we will certify it as a case of sudden infant death syndrome. What are the theories? The most common theory which is established is actually called as the common pathway of cardiorespiratory failure. That is, most of the theories are saying that these infants would have gone for a period of sleep apnea, okay, which makes them susceptible to hypoxia, bradycardia, and cardiac arrest. And respiratory infections will also, if there is any additional respiratory infections like pneumonia, any congenital heart disease, which will add to this sleep apnea, which will prolong the duration of the sleep apnea, which will further depress the respiratory centers in the brainstem, and that is responsible for sudden infant death syndrome. Okay, yes. So with this, we have come to the end of the session, that is infant death syndrome. Okay, and I hope you would have enjoyed this session, and thanking you. In next video, we will discuss about the rest of the topics. Thank you.